Experts are saying that sky high inflation is putting Canadian seniors at increased risk of social isolation. Many older adults live on fixed pensions or government benefits that aren't keeping pace with the rate of inflation in 2022. Now, this means that many are being forced to cut back on gasoline, transit fares, and entertainment costs, like eating out or taking classes. Seniors who can't afford internet or a cell phone are also less able to stay in touch with family and friends. Loneliness and social isolation in older adults has been linked to depression, an increased number of falls and use of health services, and even premature death. Well, with us now to discuss the issue is Ms. Diana Cable, the Director of Policy and Research at CanAge, Canada's national seniors advocacy organization. Ma'am, welcome to Forum Daily.
Thank you very much for having me.
So we mentioned government benefits or fixed pensions aren't really keeping pace with inflation. But what about the investment portfolios of seniors, including real estate equity, which I'm sure a lot of seniors were relying on? How is inflation impacting these long-term investments and financial security of seniors?
So, for those who depend on who are using their homes as equity and are planning on using that into their retirement, either through a reverse mortgage or some other kind of funding, they're now taking a reduced cut, meaning there isn't enough money in order for them to do all the things that they had planned to do in their retirement.
And amid all of this, what have you been hearing from seniors in terms of their quality of life following the impacts of inflation?
Well, you mentioned one of the big ones, and that's depression. It's easy to fall into depression if you're always concerned about whether you have enough money to be able to buy nutritious food or to pay for your rent or your medications. These aren't things that we should have to be worrying about.
And all of this cutting back, as we mentioned, is contributing to social isolation and the connectedness with family and friends. So, in what ways does this in particular affect the overall mental and physical health of seniors in Canada?
Well, there was a study a few years ago that came out that said that social isolation can impact your health, mental and physical health, as much as smoking 15 cigarettes a day or an overuse of alcohol. Think about that. That's very dramatic. So, if you're not leaving your building, if you're not even going out to buy groceries as often because you don't have enough money, if you're not going out to visit your friends, if you can't pay for your internet, as you mentioned, so you can't afford to do FaceTime with your children or your grandchildren or friends, even gaming online has become popular. Words with friends, for example, Scrabble with friends. When these things get cut out, you are isolated and sitting in your apartment or your home by yourself.
Some very surprising information there, Ms. Cable. So, just how many seniors in Canada are being impacted by this right now?
Well, we don't know 100%, but what we do know is that almost 28% of seniors live on their own in Canada. That's a quarter of our population or over a quarter of the senior population. So at a minimum, it's affecting, I would hazard a guess, quarter of the seniors population.
All right, ma'am, let's talk about solutions. What kind of steps can our officials take to better address the needs of seniors amid record inflation?
Well, that's a tough question because they are balancing what they can do for the entire country and helping us get through these tough times of high inflation. But I think that, and there are so many factors involved, but I think that one of the things that the government can do is that they can be listening actively to their constituents to ensure that people's core needs are being met, especially food security, housing, and healthcare, particularly when a time like this, when many older Canadians and frankly other Canadians are really, really feeling the pinch. So they need to be able to listen and respond so that people aren't making difficult choices such as choosing food or medication.
And bringing this back to our viewers at home, what are some ways that individual viewers can get involved, especially with their senior loved ones?
So, with your senior loved ones, make sure you're reaching out more regularly than you may have been doing in the past. Even a short phone call once or twice a week goes a really long way. It doesn't even have to be a check in phone call. It can, just be, hey, what are you having for dinner tonight? I'm thinking about making this. Remember that recipe you made one time? It can be really casual. Also, if you have older Canadians living in your neighborhood, reach out to them, knock on their door, invite them out for coffee. Front porch coffees are a great thing, and we still have warm enough weather that we can do that. Another thing that can happen within the community is there are lots of free programs. For example, somebody wrote into us and said that they had joined a walking club that their local library was coordinating.
Mm.
And that's a free activity, and it got them out and they were loving it. Other activities that can happen are at community centers. There are often free lectures. Um, Libraries, as I said, are a great place for things. They're connecting people with things is going to be crucially important as we go through, and hopefully inflation rates will taper soon.
All right, Ms. Cable, thank you again for your time today.
Thank you very much for having me.
We'll be right back.